Hi there, this is Dr. Terrence McCann, West County Plastic Surgeons of Washington University, and I'd like to talk a little bit about some of the improvements over the last several years that have been made to the outcomes and the recovery from tummy tuck surgery. So what are some of these? The things that come up a lot when women have had tummy tucks in the past include drainage tubes, the scar, the thickness or the potential spread of a scar after surgery. Also, the potential still to have some extra tissue sort of around the back and in through the waist area. Pain after surgery and being able to recover and get back to somebody's usual functional status. And then also blood clots and what's called DVTs. So how have recent innovations in tummy tucks gone on to improve some of these issues? So starting with the concept of drains. So nowadays, we almost never use drains in tummy tuck surgery. Instead, we do something that's called progressive tension stitches. So what we do is we sew on the deep surface the excess abdominal tissue back down onto the abdominal wall. And what that does is it reduces the amount of space that develops between the muscle wall and the overlying skin and fat. So there's less of an area for fluid to collect, meaning that there's less of a need for drains. The other advantage of that is it actually also takes the tension off of the closed scar just over the pubic area, with that advantage being that it should reduce the incidence of scars spreading. So it both reduces the need for drainage tubes, but it also can help to keep scars thinner. Other things that we can do to keep scars thinner include several new products to offset tension, as well as some other skincare products that can be used to try to reduce scar formation. In addition to that, new refinements to try to improve the overall contour around somebody's frame. So nowadays, in addition to doing tummy tucks, we're removing excess skin, fatty tissue, tightening muscles. We're now very often combining that with liposuction along the backside, the flanks, the bra rolls. So we're getting more of a 360 effect to try and narrow the waist and improve the contour, not just from the front, but also from the back. And then in addition to that, we're really doing our best now to reduce pain. So with the opioid epidemic in the United States, of course, plastic surgeons don't want to be part of that problem. And so we're trying to figure out ways to reduce pain and improve functional status quickly after surgery. So to that effect, we employ a process called ERAS, or Enhanced Recovery After Surgery. And what that means to us is that rather than giving large amounts of narcotic medicine after surgery, we give very, very little narcotic medicine. Instead, we employ something called multimodal therapy. What that means is that we're giving small doses of other types of medicine, such as anti-inflammatories, non-narcotic pain medicines, muscle relaxants, to try and reduce the overall pain effect. And that actually starts even prior to surgery. In addition to that, we use various types of nerve blocks with local anesthetic to further reduce that pain. For example, using something called the TAP block, or transversus abdominis plane block, to reduce pain. By doing those things, most of the time, people leave the hospital the same day as their surgery, so it has been converted more to an outpatient procedure. But also, in the days and weeks that follow surgery, people have less constipation, they feel like they can do more, they feel less fatigued, and they recover faster. And along those lines, to prevent blood clots, we employ anticoagulant therapies, medicines such as Lovenox, to reduce the risk of blood clots after surgery, as well as things like compression stockings, further to reduce development of blood clots in the ankles and the legs. So these are some of the things that have developed over the last several years to try and improve outcomes and make tummy tuck surgery a more palatable surgery for patients seeking this elective procedure. I hope this was useful information for you. And of course, if you're contemplating tummy tuck or want more information on abdominal contouring, please consider us here at West County Plastic Surgeons of Washington University in St. Louis. Thank you.